Namaskar, you're watching special edition of DD Dialogue titled Containing COVID, Exit Strategy, Challenges and Lessons Learned. It's a very special edition of our signature show DD Dialogue indeed, because we're going to in fact in the next 50 minutes have the talking heads of international organizations like United Nations and WHO and very important government verticals here on the show talking about the big picture. We do know, viewers, as the world continues to grapple COVID-19 situation, India is at the war footing, though under lockdown mode, but dealing with it. And most importantly, the measures taken by our Prime Minister Narendra Modi were timely and decisive. Yet at the same time, you're looking at the challenge of arresting community transmission. And also, when we talk about India's fight to deal the current pandemic, the way WHO and organizations like United Nations are looking up to India in terms of Prime Minister Modi leading the world in this pandemic fight. But on the show, in this edition of DD Dialogue, we're going to talk about is India the next world leader when it comes to containing the pandemic situation? The 1.3 billion population back home looking up to the Prime Minister, who has time and again reached out to the countrymen as large and also to the world leaders. And most importantly, the challenges that are confronting us, the significance of exit strategy. Basically, the bottom line being, are we ahead of the curve? And to do so, it's my honor to, in fact, introduce our panel on DD Dialogue, and the panel is very, very special indeed. Let me start with World Health Organization's Regional Emergencies Director, Southeast Asia, Dr. Rodrigo Orferin. Namaste. Thank you so much for joining us. Very glad to have from United Nations Resident Coordinator, UNRC, Ms. Renata Dessalien. Namaskar. Thank you again for joining us on the national channel. And of course, the Chief Economic Advisor to the Government of India, Dr. Krishnamurthy Subramanian. Thank you so much for joining us. And yes, the CEO of Prasar Bharati, Shri Shashi Shekhar Vempati, joining us also on DD National. In fact, I would like to start with Dr. Krishnamurthy, because this is going to be extremely important for our national audience to know from you. The whole rationale behind this very important order that was recently released by the government, opening of shops. Many are questioning the timings of it, and but the good part about it, if I may be allowed to say so, Dr. Krishnamurthy, is that is India slowly and gradually opening up?
First of all, thank you, Sakalji, for inviting me to this very special episode. Economists have talked about this trade-off between flattening the pandemic and the impact on the on the economy. What is quite important here is to try and gather some insights from previous episodes.
Okay.
And we all recognize that we're living through times that none of us would have encountered in our lifetimes. But an episode more than 100 years back, which is the 1918 Spanish flu, is quite informative, because this is a pandemic that affected 1/3 of the world population, and the mortality rates were 10%. And from my reading, this parameter called R0, which captures, the how many people is one infected person likely to infect, seems to be similar for the the Spanish flu and the COVID. And so there are important learnings, and the most important learning which has been incorporated into our own decision making is the fact that this trade-off that I talked about doesn't seem to be that strong when you look at the the Spanish flu pandemic, especially if you look at counties in the United States, and counties are equivalent to districts in India. Those counties that implemented what are called non-pharmaceutical interventions, which is a lockdown is basically a very extreme form of a non-pharmaceutical intervention that can include school closures, church closures, shopping establishments actually being closed, etc. Those counties that implemented intensive non-pharmaceutical interventions were the ones where the mortality rate was low, but at the same time the economy, once the pandemic was over, employment increase was also higher. Which means that actually, as our Prime Minister has mentioned,
I'm trying to say that once this is over, we will not have any issues when it comes to disruption of employment chain.
No, what I'm trying to say is that those countries that actually have been, ahead of the curve, taking the necessary measures to protect lives, are the ones where the eventual impact on the economy is also likely to be better. That's the rationale for the measures that we've actually adopted, starting with the lockdown on the 24th March.
And this order is one such move.
So this order actually is now, a step towards gradual relaxation
That's
of that.
the big news point.
Which is important because, and the way this is being thought through is, first we need to look at the intensity of the pandemic in particular geographical areas. Second, we also need to look at sectors of the economy where the economic activity requires a lot of interpersonal interactions.
We'll come to it. We'll come to the economic.
And let me just finish that thought. And third part is actually the contribution of that sector to economic activity. Based on these three, the gradual relaxation is happening.
So that is obviously the work under progress. But Mr. Nanda, I would want to know from you, because we were, in fact, first of all, do you agree that India was first among rest of the countries to react and respond to the situation when the first case was detected in China, sir? On 7th and on 8th, our government started working, and since then we are working towards containing pandemic on war front. But what is most important is that our advisories were out on 17th itself. We started screening our travelers, international travelers, and so on and so forth. So when you look at India's response to this pandemic, which did not come with a template, by the way, vis-a-vis how other developed nations, I'm saying developed nations, dealt with it, and they continue to do so.
Secretary, also thank you so much for having me on this program. Delighted to be here. This virus is completely new. It may be part of the corona family, which has other viruses, but this virus is completely new, and it's taken the world by surprise. I think nobody was prepared for it, really. Of course, you can imagine it in sort of science fiction kinds of ways, but we don't know enough about it, and so we're operating semi in the dark. Of course, we had references to Spanish flu, but that's a generation ago. None of us lived through that. So it's taken us all by surprise. And I think that if you look around the world and you look at the countries that have managed to flatten the curve, it has taken extraordinary effort. It has taken actions early on, and it has taken, how shall I say, a lot of foresight, because we don't, as you said yourself, we don't have a template for this. And India is among those countries, for sure. India acted very quickly. India, I think it was on the 6th of January that China actually declared that this was a virus from the corona strain, right? Or family. And on the 7th, already the Minister of Health was, convening people. And on the 17th, as you said yourself, I think he was already giving advisories to all states and union territories. Very shortly after that, the Prime Minister convened an empowered group of his ministers to work in a whole of government manner, which is extremely important in response to a virus like this, which affects, of course, not only the health side, but also the socioeconomic side of life and of society. Shortly after that, he declared that there would be 11 empowered groups looking on very specific dimensions of the government's response. There was outreach to the private sector, there was outreach to civil society organizations, obviously outreach to the population. I was extremely impressed at some of the early preparations that went into trying to bolster the health infrastructure, to prepare the health workers, to get risk mitigation messages out there in multiple languages.
So as we speak, we'll continue the discussion and take it forward. As we speak, the whole ramping up of health infrastrucstructure is underway, even as we speak, whether it Dr. Offren, your thoughts on it, whether it comes to adding more laboratories, more numbers to COVID care. Well, we started with one hospital, and now, I mean, that's the work under progress. But WHO says, and when WHO says, I think it makes a lot of sense when it says that they're looking at India, the way India is dealing with the situation and the decisive fight containing COVID-19, which is important in terms of containing the global war. The capacities, the capabilities. What I'm trying to ask you is that India being looked up as a provider, whether it is HCQ or the way our Prime Minister has time and again not only reached out to his own countrymen, but SAARC nations, but G20, etc.
Yes, thank you, Sakal, for the question. And I'm enjoying the discussion because it's a look into an epidemic, a pandemic, but with a larger view. It's not just a health impact that we're looking at. It's not a disease per se, but how a whole of society, whole of government approaches such a crisis. So yes, and that was a statement from us, WHO, that we're looking up to India, because there's a whole history of India being able to eradicate
polio
diseases, whether it was smallpox, if you do remember, as well as polio very recently in 2014. And I think because I work in the region, the perspective of countries around the region, they're very attuned to outbreaks like this. It was not so long ago that SARS was there.
Yes.
And very recently MERS. So I do know that once the alert came out, queries from countries happened and the actions began. So let me bring it back to India, the leadership, it's at the highest leadership. Okay. That's what you want. It's not a response that is contained with the health authorities alone, but with the highest leadership, because it will require all of government and all of other sectors to help. So that was very early on. So you have Transport Ministry, airport authorities,
everybody
doing thermal screening. Ministry of Foreign Affairs working with other countries to repatriate some of its students and nationals back, and not only Indian nationals. There were also other countries that couldn't afford to have a chartered flight. So you had some Maldivians and other countries taking that plane back and being able to quarantine them comfortably, safely, and testing prior to return. So that was very correct. So it was a whole of government approach, and I'll just follow through the discussion or the intervention of Renata here, where yes, there are 11 empowered groups, but the coordination at national and then state and district level, that's key. Coordination in a way saves lives.
Yes.
If your work is in isolation and in not connected or linked, then you will have problems of duplication or covering areas that may not be covered.
Yes.
So this is very
we'll talk about a certain attempt by certain sections of international media to set in a certain kind of narrative around the whole testing capabilities of India and all of that, even at a time when the world is watching and we are supplying the drug at this juncture which matters the most. But before that, sir, time and again, Prime Minister has addressed nation, the pandemic address. The outreach has been immense and there has been an emotional connect, and the latest being his blog. And we at Doordarshan have been also at the war front doing our duties and responsibilities at this point, whatever is expected from a national broadcaster and beyond. Just to put it in perspective, the larger optics and the messaging, so far, the crux of Prime Minister's outreach to the national audience.
First of all, let me thank this esteemed panel of experts for joining us today. And as you rightly pointed out, the public broadcaster has been at the forefront of this battle that India is facing. Before I respond to your question, I just wanted to make one point. When you talked about this coming without a template, not only has the pandemic come without a template, there is no template for 1 billion people democracy to deal with, right? And I don't envy Dr. Krishnamurthy's job because nobody knows how to deal with this, and the fact that we've been able to contain this to a large extent, and we are already taking baby steps to get the economy going, I think speaks a lot to how we have approached this problem. There was a very interesting chart that I was looking at, shared by one of the MIT professors recently, where he talks about the various economic activities and the potential risk because of the density of people that need to work together, and the economic value, and that kind of maps all the various things. And so on the right side are those with the highest risk, and then on the left side are those with the least risk, and then of course the economic value and so on. So what I see in the kind of decisions that are being taken, which he's probably privy to, not me, but what we are all observing and reporting on, and like the example that you spoke about, some retail outlets being opened and so on, I see there's a method to it, and it is being guided by these sorts of frameworks. And what the Prime Minister wrote in his LinkedIn blog, he was already thinking 2 steps ahead, that we'll eventually come out of this pandemic, but what do we need to do to get our economy going?
Yes.
And so we take a leadership position, and as Doctor was rightly pointing out, there's a lot that India can show to the world, and how we deal with this. And so there were 5 elements to
Yes.
what the Prime Minister shared in his blog, and I think each one of them is going to be extremely relevant. One example I'll give right now was on adaptability, how adaptability is so important, and what underlines this is you had the governors, I think, of New Jersey or New York putting out a distress call for COBOL programmers. The reason being their social security systems are still based on mainframe computers. And here in India, we had Jan Dhan, Aadhaar and mobile, and we got people getting their direct deposits within no time, because we knew who the beneficiaries were.
Note of that.
Exactly.
Yes.
So look at, we've just leapfrogged several generations ahead.
Yes.
And if I may add to that,
yes,
Shekhar,
please,
actually,
please.
I think, and I want to bring a behavioral economics perspective to this measures that have been announced. Having written on this in the economic survey in July, see, one of the as humans, we respond to crises like these with a lot of fear. And what is called saliency bias, which is that when we see some data that is just so proximate, we sort of overestimate the fear or the consequences of it. And in times like that, therefore, actually, the message that that none of us is fighting this particular pandemic on our own, that we have actually the community to help us, I think is a very important point. And that is what these messages, the addresses to the nations really addressed. Similarly, on the coordination that Doctor was mentioning, see, in a country like India with 1.3 billion population, with such differences in terms of the level of education, awareness, etc.
Economic disparities.
Economic disparities, all
Population
kinds of
density.
differences.
Absolutely.
And more importantly, for a pandemic like this, the level of awareness of how much precautions one should be taking. In this, actually, both the address to the nation as well as the lockdown itself, one of the key things the lockdown has done is to clearly drive the point home to the common citizen on the street, how important it is for him or her to take the necessary precautions. And I think in that context, definitely with others that I already mentioned about, but this coordination and bringing the awareness, I think this is a very important step.
Quickly, because we're talking about the economics of it now, there's a lot of anxiety, and quite understandably, the disruption in not only supply chain, how are we going to deal with this situation forward thinking next 3 months post exit or whenever the exit happens, and disruption in employment chain, the low wage workers, the employment, people are losing employment. Although I think we were the first country, in fact we will take a reaction from WHO and UNRC also, to come up with such a robust social relief package. I don't think any other country has done that, Dr. Krishnamurthy.
I think, see, at its basic, when you think about, actually, this is like a war-like situation.
Yes.
But there are with important differences. In any war, what happens is there are, because factories, people die and factories get bombed, etc. Supply side, there are huge disruptions.
Yes.
In contrast, in this, actually, the main disruption, the main thing that starts is a demand side disruption, because people will not buy as much non-essential items, and then it has actually its ramifications on, for instance, small and medium enterprises. And here's where, on the demand side, especially for vulnerable sections of society, in a country like India, I think the JAM Trinity has been a big boon, because one can clearly sort of portray this counterfactual, which is, but for having this JAM Trinity, actually this infrastructure with us, and with the constraints of social distancing, being able to reach the vulnerable sections of society may have been a gargantuan challenge.
Yes.
And I think this is where the JAM Trinity has really helped, especially the Jan Dhan account.
Yes.
And for instance, we were looking at some data, the amount that is actually stored, balance in the Jan Dhan accounts has increased about 15,000 crores, together with the essential commodities, cereals, etc., that's been given, where the PD as a public distribution infrastructure has been really critical in being able to reach it, where the tire meets the road, as so to say.
Yes. talk about the migrant population. This is one aspect which is something we haven't ignored and we will never ever ignore. Our Supreme Court has taken note of it, that they need to be dealt. The human rights aspect of it, and I think UN has time and again talked about that as well. I would like to know from you, Renata, that it is very important to weigh such measures also. And where do you think how India is doing in terms of ensuring people's right to privacy? There's a lot of stigmatization also attached here, though our government is very particular about our social workers, our healthcare workers, and no particular community should be at the receiving end of this, and all of that, you know, the social narrative of it. How do you respond to the way India has gone ahead and dealt with that?
Yeah, thank you. I mean, there's no question that the migrant population, I think, took everybody by surprise, the fact that there would be so many that would want to move. I think the Prime Minister, when he made his speech at the beginning of the lockdown, he was appealing to people to stay home, and how that necessarily got interpreted in people's mind as to sort of somehow stay safe, and maybe stay safe was
cut
back
the ice instantly.
Yeah, so I think that it took people by surprise. And it's an enormous challenge. I mean, there's no way about it. There's an enormous challenge to try to deal with the basic needs of so many people.
Okay.
And I just wanted to say that, of course, the immediate provisions that were made through the $23 billion package that was announced, which included food, the fact that the COVID-19 was notified as a national disaster, which also liberated the National Disaster Fund at the state level to fund a number of things, including food and housing for these people. So there's no question there's been an enormous effort. The public food distribution system working overtime. My colleagues in WFP, the World Food Program, are working very closely with the government, with some of their networks, trying to also help, because with any gigantic issue such as this, there are bound to be some gaps, and there are bound to be, you know, some who either don't have the cards, or who thought they had the cards or didn't have the cards, or so there's an enormous amount to do above and beyond the very fact of distributing food through the system as it was supposed to be. So I think huge efforts have been made. I think the government also realizes that it can't go the last mile always.
I was coming to that.
They've
question.
appealed to civil society organizations. Hundreds of thousands of civil society organizations have come out to help. Individuals have come out to help. Private sector has come out to help. So there's been a big response. Is it enough? Probably not yet, but I'm hoping that, you know, with the economic recovery that comes through, and the second economic package that comes through, there will be more assistance. And of course that works, you know, hand in hand with the whole issue of how to get some of these people back to work in a manner which is still safe for the whole country.
So for Dr. Krishnamurthy and his team, the job is cut out for them for many months to come. But before we take a break, Dr. Offren,
could I just say something on the issue of stigmatization?
I'm coming to that. I'll really make one quick comment, and we'll touch upon that again. Dr. Offren, now we have our government briefing the media, addressing the country on daily basis. There's a daily briefing in terms of numbers. What is WHO's assessment? Do you think there is still a grey area when it comes to curbing the whole community transmission thing? There is a certain amount of anxiety also revolving around that aspect. We've not been able to contain the numbers, but what is WHO's evaluation? Do you think that the death rate is coming down, and maybe the recovery rate is also going up?
So to answer that question, I think we have to understand that India is a huge country with states and union territories. I think to lump it as India doesn't do justice in terms of an epidemiologic perspective. So every state is in a different transmission scenario, which what we're looking at in different countries. And I think the important message here is that the Ministry of Health and all health workers, health authorities have actually been working so hard to do the basic public health measures that work, which is to detect a case, test for a case, isolate a case, trace its contacts, and care for those who
we have revised our testing guidelines also.
Positively. Yes. So as the transmission scenario changes, the testing strategy was changing, as rational as it could be. That was a very good move. As of now, you have more than 200 labs, more than 85 private labs, And as of yesterday, more than 550,000 tests were done, and around 23,000 plus were found to be positive. On a single day, 35,000 tests can be done. Further scale up of testing, of course, there's room for that, but it is these other public health measures that I've mentioned will help, to be able to detect, to be able to test, isolate, and care.
So can I say that WHO does contend that the whole argument questioning India's testing capabilities stands no ground? Very quickly.
India has been revising its testing strategy as per the transmission scenario, and that's as appropriate as you can be in any response to any outbreak.
I think that's the writing on the wall coming from the man at the helm of World Health Organization here, Dr. Oferin, saying that there is absolutely no doubt as far as India's testing capabilities are concerned. And in fact, we're going to take a very short break here, viewers of National Broadcaster Doordarshan. Don't touch those remotes. When we come back, we have a lot more for you. Being ahead of curve, and are we actually looking at a curve which is flattening, and much, much more on the other side. Please don't go away. Welcome back. You're watching special edition of DD Dialogue with the top talking heads from UN, WHO, and Chief Economic Advisor to the government here, and also Prasar Bharati CEO. So let me come to you now. The way Prime Minister has dealt with this subject through various and numerous national addresses on pandemic, it has also, would you agree, turned this into a national movement?
Absolutely, and let me just go back to the point that he made, that
Sure.
the Prime Minister gave this call and people stayed at home. I think it's very important to recognize how he made that call. He invoked the metaphor from the Indian epic Ramayana when he said, there's a proverbial Lakshman Rekha and don't cross that. And that is something instantly everyone in the country can relate to. Because when you look at the Prime Minister's messaging, he is addressing 1 billion people. So it is the least common denominator that needs to be able to relate to what he's saying, right? So the Lakshman Rekha as a metaphor is something right across, all strata of India, every corner of India, everyone can relate to. That you cross that line, you're in danger. You stay behind that line, you're safe. So you stay home, you're safe, right? So that is the kind of communication that he's able to deliver, and that produced a truly national movement. There were two things that he asked people to do, right? One was, stand up and clap for all the Corona warriors,
Yes.
and then light the lamps,
Yes.
to stand in solidarity and send this message that you're not alone. A very interesting statistic that the television rating system had recorded that day was that Ramayana that we've been airing on Doordarshan has hit all the charts, all the records as far as viewership is concerned.
Yes.
But those 9 minutes, because that day we delayed Ramayana by 9 minutes,
Okay.
and those 9 minutes, the television rating system recorded its lowest viewership because people stopped watching TV, went and lit their lamps, and then they came back and watched Ramayana, and again the chart hit up. So you could see that he truly produced a national movement.
Yes.
And I think that is very unique to what happened in India.
And just to add, actually, if at all anybody didn't know Lakshman Rekha, there was Ramayana to actually go and learn it.
There we go.
Yes. But Doctor, okay, now the economics of it. the coming 3-4 months are very crucial. We were talking about the social security package, and especially those below poverty line, and the last mile connectivity that UNRC spoke about. Dr. Krishnamurthy, challenges, there are challenges. I mean, could you just talk about, just in brief, what is the way forward in terms of containing these numbers? I'm talking about basic things. I'm talking about supply, I'm talking about employment, I'm talking about insurance cover, all those things.
See, as I was saying earlier, Sakalji, that the main impact of this is first on the demand side. And then, you know, when companies, let's say, are not able to take care of their costs, that may actually lead to supply side impacts. So the prescription therefore has to be to work on both the demand side and the supply side. On the supply side, it is important to take care of the working capital requirements of firms, because for them, you know, especially for the small and medium enterprises, while their costs, you know, many of their fixed costs continued, revenues were not as much, and therefore, you know, expanding working capital facilities enables them to actually stay alive and thereby reduce any supply side disruptions that may happen. So that's one key aspect of any, you know, any economic stimulus. The second key aspect is, as I said earlier, which is to work on the demand side itself, and thereby, you know, especially taking care of the vulnerable sections where the, you know, what we economists call the marginal propensity to consume, which is, if suppose a rupee is given, let's say, you know, it's given by the government, you know, then how much of that will get consumed? Turns out that marginal propensity to consume is the maximum in the vulnerable sections.
Okay.
So when money goes in the hands of the vulnerable, that will actually impact consumption as well, and thereby, you know, bring up demand. So these are two critical aspects. There are of course other aspects that, you know, one can talk about, but in terms of the economics, I think these are the two, you know, by far the most important. Together with that, the last part is actually the financial sector and forbearance there, because, you know, you don't want companies to be actually given this exogenous shock that there is.
They already are under a lot of shock.
And therefore, exactly. No, there is a shock, and undeniably there is a shock. What we want to do is therefore to forbear in the sense that, you know, non-performing assets, recognition of asset, you know, NPA norms, etc. Those have to be relaxed, and the Reserve Bank has already actually taken steps in that direction, and the government is also looking, you know, working on supporting those measures.
Coming back to UNRC, you wanted to make that very important point on the whole stigmatization. We as a country, our government, the ruling dispensation, taking care of the human rights aspect of it. UNRC, your thoughts on it, and also the fact that India, we have actually co-sponsored two important UNGA resolutions, most importantly the latest one on the you know, equitable access to COVID-19 vaccine. So the assessment in terms of the internal human rights aspect and also the external aspect of it, that how India under the leadership of Prime Minister Modi is at the forefront globally. Because if you look at the kind of statements that we've had repeatedly coming from UNRC as well as WHO, he seems to be at the front when it comes to the world leaders, isn't it?
So I think Prime Minister Modi himself said that this virus doesn't know any discrimination. That you know, basically he was calling for unity and solidarity. He said whether it's, you know, it doesn't know religion, it doesn't know color of your skin, it doesn't know caste, creed, language, other borders, it doesn't know anything like that. And I think that that's what's needed right now. It's unity and solidarity, whether it's at the country level, which absolutely is needed, and whether it's at the international level, where the same solidarity and the same unity is badly needed. And unfortunately, the community of nations are not delivering on that unity right now at the international level.
Barring India. India is delivering.
So I wanted
India is delivering.
India, of course, is delivering.
India is
I think that the important thing here is that this is a disease because it doesn't discriminate against any of us. Basically, the response is as strong as the weakest link in the chain.
Yes.
I mean, the Secretary General himself has said that nobody is safe until everybody's safe.
Absolutely.
And that's as true for India as a country or any country as it is for the global, you know, the global community.
Ma'am, you made a very important point that the community of nations is not delivering, but India is delivering. And in fact, India has gone beyond the deliverance thing. Very quickly, let me take this point to Dr. Ophrin. Now, India is at the center stage, would you say? Well, I'm not trying to say that everything is fine, everything is good. No. India is, but certainly at the world stage, at the center stage, when it comes to being seen as a provider for that HCQ. Not only that, our Prime Minister has been in touch with all top global leaders on this, and your organization is also, in fact, recognized a social relief package, or free supply of gas cylinders, ration, etc. And no matter how much you do in that space, you will have to do more.
Yes, but I think what we need to look at is the efforts that have been put there. I think it's very clear that the government is seeing this pandemic, as not just a health issue, but a social and economic issue, and it's something that, as a country that is ahead of some of its neighbors in terms of economy and technology, they're able to share. I see India as the pharmacy of the world. This is precisely why it is able to provide essential medicines.
Pharmacy of the world.
Yes.
Okay.
It is known. India is well known as, with that title,
Yes.
as the pharmacy of the world, because it's able to provide quality medicines at a very cheap price, and many countries do buy from India. I mean, pre-COVID anyway, even and now to provide support to so many countries, whether neighboring or afar. So I think that's where India is placed, and I think there will be more of a role for India in terms of showing the way, in terms of a massive response that's been going on with the work that's being done by Ministry of Health in terms of what I've been saying: surveillance, contact tracing, testing, caring for, preparing hospitals, protecting healthcare workers, risk communication.
Yes.
It's a whole how do you say, spread of action, scope of actions, even just in the health sector, and at the same time, if it's able to also support other countries, because as Renata said, that's the concept of health security.
Do you see that thing missing in some other nations, because you are at the helm when it comes to dealing the emergencies, when it comes to, particularly if you talk about the Southeast Asian countries, not really comparing with others, but then our instant response at all levels. Like she pointed out that some of the countries are not delivering. Maybe they don't want to deliver. There are lots of challenges. We do have our challenges as well, but we are.
Yeah. So at some point, in fact, that was the call of the Director General in Geneva, that it was also partly called a pandemic or declared as a pandemic because other countries were not taking it as seriously
As India.
And so if you've seen in the region, in terms of numbers, or Southeast Asia region and the Western Pacific, Asia Pacific as a whole, it's not as high as the rest of the world. Practically because of the early actions that we have talked about, because these countries have also seen other epidemics before, and they have invested in preparedness. They have invested in these capacities for surveillance, contact tracing. As you said, there will always be more to do.
Yes.
Especially we are looking at this as a marathon, not as a sprint. There will be more risk assessments to be done.
Yes.
At state level,
It's a
at
long
district
drawn
level.
war.
Yes, and so to see to it and be agile in your strategy, I think Sir pointed that out, is that that will bring you to better success. As you are monitoring numbers of your ratings, we are also monitoring trends. I think
reaction on
that was
please.
key.
Yeah, absolutely. I think the adaptability, the agility is very important. If you remember what the Prime Minister wrote on his blog, he said we have to think digital first. And today, I think
Home is new office.
Yeah, the industries, the businesses that are going to survive and come out of this standing are those who have transformed themselves into digital first businesses. Sometime back the acronym "Bring Your Own Device" was common in the corporate world, BYOD. Now it's all WFH. Work from home. And one of the things that, for example, we as a public broadcaster, because we adopted electronic office applications early on in the last 2 years, it actually helped us in coping with this pandemic. And I think it's a great example of why it is so important to go digital, why it's so important to be agile, because you don't know where the next surprise is going to come from. And your ability to react and respond to it is very, very crucial based on how agile your operations are. Also, going forward, we will have to rethink, what does efficiency mean? We had the traditional work culture. You come, you clock your 8 hours, 9 hours. That was what was efficiency. And I think the Prime Minister very interestingly brought out that we'll have to rethink what that efficiency means.
New norm, sir.
Yeah.
New normal.
Right. And I think the other most interesting thing, which there have been several news reports, we've also written about it, how suddenly the air is purer, animals are
Yes,
finding
absolutely.
freedom.
Yeah.
In fact, we've started
Or
a new
animals are missing humans.
we've started a new segment on All India Radio
Yeah.
at 5:45 a.m. every morning. You can listen to the birds. It's called Dawn Chorus. So because there's so many different birds, and all the urban areas, the bird population has become so active. So we will have to look at technologies, lifestyles which are far more inclusive, far more climate friendly, and respect nature, because that is where all these pandemics are coming from, between human and wildlife interactions, and
Yes.
so we'll have to pay a lot of attention to that as well.
And in
Well,
fact,
and PM, yes, ma'am, please.
I was going to say, just in the context of this long marathon that we have in front of us, and it will be long, right? I mean, barring some miracle, it will be, at least 12 to 24 months. I think that this gives us, just as the lockdown has given us extra time to prepare for what lies ahead in terms of the trajectory of the disease in the country. I think that this marathon period ahead of us is time to reflect. We know that globally things were not great. We know that we've selected a global model for development that is killing our planet. I mean, it's killing the environment, and the fact your reference to birds is what triggered that.
Yes.
And I think we have to build back better. We have to find a way of building a strong economic system, a strong socioeconomic response that lifts those that have been left behind, because let's face it, more equitable societies fare better in these kinds of shocks. And also that is kind to nature. We just had Earth Day the other day. You can see people wistfully, thinking about nature, and everybody wants to have a modernization process that allows them still to hear the birds and to appreciate the
Yes.
grass and the trees, etc. So we were on this kind of race course, growth at all costs,
At all costs, yes.
which was unsustainable. And of course, the fear is, apart from the virus, is that we're going to go back to that. And I really hope and I pray that a little inkling of wisdom gets results from this pandemic and all the suffering that is happening around this
So
pandemic.
the world has
And let
changed.
me add
Sure,
to that. Actually,
sure.
I think here again, I feel that India really has the opportunity
Yes.
to set an economic model.
Yes.
Okay.
In the economic survey that we wrote, that got published in January, we talked about how in India wealth creation was always a combination of the market economy, but at the same time actually the hand of trust and the moral fabric. In fact, Saint Tiruvalluvar in Tirukkural actually says that wealth creation has to happen without harming anyone else. And when you think about that, without harming anyone else, it brings under its umbrella actually almost everything that we're talking about today. And therefore, this model which combines the some of the aspects of the market economy's elements, but with a very, very strong fabric of social and moral foundations, I think, and that is, by the way, we showed the first chart in the survey was the fact that for 3/4 of known economic history, India was the leader, in terms of GDP. And that we delivered that by following a model that had the combination of both of this, which is what we actually need today. And therefore, I really believe that India has the opportunity to actually be the leader in setting the model for equitable growth, and also growth that respects some of the sentiments that are being spoken about.
I'm going to come to Dr. Afrin. In fact, this is the last lap of discussion, so final comments, Dr. Afrin. You wanted to make a quick point there. To add to that, let's now talk about challenges also a bit. Let's touch upon the challenges, because it's not as good as it really seems. We all agree. Right.
Well, I just like to react a little bit for that, and it's probably, to phrase it better, it's not build back better, but build back different.
Okay.
It requires a very insightful rethink of how economies are, how we live our lives, culture, etc. It will be totally different and maybe better for and more equitable for everyone. So I think challenges, as I said, we have to look at India in terms of several states, 1.3 billion people. Every state like a country. So
Every state is like a country.
yes, in
Size
terms
of a
of
country.
in terms
Yes,
of
yes,
your
yes, yes.
your population.
Yes.
It's so oversimplification, but you want to simplify I want to simplify my reply, but not to oversimplify. So the idea being your challenges, the challenges that we face are metros, very densely populated areas. How does this affect yours? Physical distancing. Physical distancing versus social distancing. You don't want to lose the social connections, and that's maybe why we are still on our phones, getting in touch with our families and friends elsewhere. So the density of the population is
A huge challenge.
helps the virus to transmit so fast. So
Yes, it's a
that's
challenge.
a huge challenge. Mobile populations. Cities are places of work, but not the places of residence. So people are moving. That's how it was pre-COVID. So to rethink that, that's one. The differences in capacities of health systems in every state. That's also
Okay.
that's also one. Access to healthcare remains a challenge for various areas. So
Yes.
so that's something to bridge. So these are
That's
the
where
areas.
the states come in picture.
Yes, and that's possibly how you'll have to think about, as you were saying, exit strategies. Really assessing risks at different levels, addressing questions such as, if you ease the lockdown, will you have a resurgence of cases?
Yes, I
If
think-
you ease the lockdown, will your public health capacities
Yes,
and your hospital
yes,
capacities
yes.
still be there?
All right. So if you ease the lockdown, the challenges are many. Very quickly. Final comments.
Yes, well, I mean, I agree with many of those challenges that have been outlined. I think as we're thinking about this challenges, I'm also thinking about it the flip side, how to build back different or better. And I think, really, as we build back, there has to be much more investment in the health sector. I think that one of the reasons that there are concerns about lifting the lockdown, I mean, of course, there would be concerns in any country. So India is not unique on this front. India is, of course, very unique, but on this particular front, it's the same challenge that other countries face. And so I think that we have to invest much more in the health sector. For decades, there hasn't been adequate investment in the health sector. So I think this is creating part of the challenge that we have now.
So Man on Mission is listening to you very carefully. Okay. So your Professor Subramanian, your take on it?
I think, I do agree that this is going to be a process.
What would
that
be
is
your message to the country on behalf of your ministry? You see, people want to know, and I don't even have to tell you what they want to know, right?
So the message is very simple. We've been working very hard during this period of lockdown. The deluge of inputs that has come to us, ideas that have come to us. We've processed all of that, and we've internalized it. And the key message is we are trying our very best to support the economy, at this stage.
Last
Within
mile
the
connectivity, the have-nots are more important.
Yes, and so it's really important to keep in mind the vulnerable sections. I think a characteristic of people in the ministry, including the Honorable Finance Minister, is that we all come from very humble backgrounds, and therefore we can relate with the individual on the street. And as Gandhiji said, he or she is the talisman that actually we keep in mind while we are thinking about working about the the policy for the economy.
Okay. So, final comments by PM
Final
also.
comments. So I think first of all, I want to tell these guys, you are at the front line, battling the economy, battling the pandemic.
Yes.
We are here to support you as the public broadcaster of the world's largest democracy. Secondly, while there are challenges, there are also opportunities. To give an example, how do you engage students in this environment? Not everyone has a computer at home. Not everyone has internet access at home. Luckily, India, we had built the world's only free-to-air DTH platform, which gets into 35 to 40 million households. So people can access free education channels about 40 to 50 of them, and there can be no disruption in education. And we are actually making it happen with both Doordarshan and All India Radio through this DTH platform. So these are the kinds of solutions that will help us in braving and fighting this pandemic and coming out of it. And these solutions that we come up with, like all the ideas that he was referring to, ultimately will have to be designed in a universal way so that the rest of the world can adopt them. So it's not just India thinking for itself, but India doing its bit so that entire humanity, mankind, comes out of this stronger.
Yes, I wanted your specific reaction. The Prime Minister also mentioned in the blog, sir, that post COVID-19 we still have to be ahead of the curve. I mean, it's not just we are thinking about when will the lockdown be over. I think after lockdown, it's going to be a different life for the world, not only for India. Yes?
Absolutely, and I think a lot of innovation will come out of India, because in India you have all the extremities. You have dire poverty on one end of the spectrum. You also have the latest technology savvy population at the other end of the spectrum. So solutions that get designed in India will have applicability practically in every corner of the world, and hence there is the opportunity for us to get ahead.
India will, the world will continue to look at India even post lockdown, and I think WHO and UNRC would agree to it, because it's going to be a different world altogether. You would agree, gentlemen, and ma'am also, that post lockdown it has been a different world. The COVID has changed the contours of the globe, and post that it's going to be a different world. But what is more important is that world will continue to look at India, look up to India. And on that note, thank you all of you. It's been a great pleasure to have you on the show. We have, of course, Dr. Rodrigo Offerin, WHO Regional Emergency Director, Southeast Asia. Thank you very much, UNRC, Ms. Renata Desalin, for joining us on the show. Very, very thank you to Chief Economic Advisor to the Government of India, Dr. Krishnamurthy Subramanian, and Prasar Bharati's CEO, Shri Shashi Shekhar Vempati, all of you. And with that, it's time to wrap up this special edition of DD Dialogue. Namaskar, stay home, stay safe.
आप देख रहे हैं डीडी नेशनल, इंडिया का अपना चैनल।
मैं आपका साथ मांग रहा हूं, 7 बातों में आपका साथ। पहली बात, अपने घर के बुजुर्गों का विशेष ध्यान रखें, विशेषकर ऐसे व्यक्ति जिन्हें पुरानी बीमारी हो, उनकी हमें एक्स्ट्रा केयर करनी है। उन्हें कोरोना से बहुत बचाकर रखना है। दूसरी बात, लॉकडाउन और सोशल डिस्टेंसिंग की लक्ष्मण रेखा का पूरी तरह पालन करें। घर में बने फेस कवर या मास्क का, और वो भी घर में बने हुए, उनका अनिवार्य रूप से उपयोग करें। तीसरी बात, अपनी इम्यूनिटी बढ़ाने के लिए आयुष मंत्रालय द्वारा जो निर्देश दिए गए हैं, उसका अगर हम पालन करें, गर्म पानी है, काढ़ा है, इनका निरंतर सेवन करें। चौथी बात, कोरोना संक्रमण का फैलाव रोकने में मदद करने के लिए आरोग्य सेतु मोबाइल ऐप, आरोग्य सेतु मोबाइल ऐप जरूर डाउनलोड करें। दूसरों को भी इस ऐप को डाउनलोड करने के लिए प्रेरित करें। पांचवी बात, जितना हो सके उतने गरीब परिवार की देखरेख करें, उनके भोजन की आवश्यकता पूरी करें। छठी बात, आप अपने व्यवसाय, अपने उद्योग में अपने साथ काम करे लोगों के प्रति संवेदना रखें, किसी को नौकरी से न निकालें। सातवीं बात, देश के कोरोना योद्धाओं, हमारे डॉक्टर, नर्सेस, सफाई कर्मी, पुलिसकर्मी, ऐसे सभी लोगों का हम सम्मान करें, आदर पूर्वक उनका गौरव करें। साथियों, इन 7 बातों में आपका साथ, ये सप्तपदी विजय प्राप्त करने का मार्ग है।